those kinds of medications, benzodiazepines, and the usual, anxiety, agitation, that's its most common use for it. But I also use it for patients who have really erratic heart rate. So those times before when your heart rate's gotten really high, right? And if it were to consistently stay like that, then I would probably be like, okay, let's go ahead and talk about taking a half of one of these, once a day or something, and it will start to bring your heart rate down, allow your heart to rest. But another use is nausea. So a lot of people don't know you could use lorazepam for nausea.
Okay.
It's very effective.
Okay.
So that's one of them. Lorazepam. What else we got in here? Promethazine is so like, have you ever used Zofran?
I've never used Zofran. I've heard of Zofran.
It's for nausea.
Okay.
Typically, it's used for nausea and vomiting. And there's some other things that you can use for it, but primarily it is for nausea.
Okay.
Promethazine can also be used with cough syrups to kind of prolong the effects of your cough medication, but we have better stuff for that anyways. So hyoscyamine is not my favorite. There's a better drug that I will use if a person starts to have secretions. So sometimes at end of life, people can have what's called terminal secretions, and all it is the same stuff that like you and I can usually clear out, like just saliva, mucus, or even like GERD, like gastric reflux. Usually if it gets stuck in our throat, we can go kind of clear it out. But at end of life in particular, when we're not able to really clear it, sometimes it can kind of start to come out. It doesn't happen to everybody, but sometimes it does, and this is a medication that can kind of clear that out. If that were to become a problem, there's a better drug that I would probably use anyways, but just to have it here in the meantime. Okay, this is a big dose of Tylenol. It's 650 milligrams of acetaminophen. If, say, you were feeling really, really sick and you're not able to keep anything down, like a Tylenol or anything like that, we've got a Tylenol suppository.
Well, praise Jesus, no. Okay.
And with fevers and everything, it makes you feel really bad. It can be a pretty awful feeling.
I know.
But pretty much everything in here can be used when a person is not really able to swallow very well. So like the tablets can be dissolved under the tongue or in the oral mucosa in the mouth. And just so you know, if it doesn't have if a medication does not have an enteric coating for extended release, it can be given rectally. Anything that can be given orally can be given rectally. Literally anything. Just so you know. And then the other one that is a suppository is a bisacodyl, like a Dulcolac suppository for constipation.
Okay.
And then last but not least, this is oral morphine. So this is not the same stuff that they give you in the hospital with an injection.
Okay.
So this is a very short-acting morphine, and the primary use for this is actually shortness of breath. So, because we have better stuff for pain. We got stronger, better stuff for pain. The primary use for this medication is when patients start to get respiratory crisis and they are if they can't breathe very well, this will really cut that dyspnea, that shortness of breath, and it allows them to get more out of each breath. It kind of slows that, we call it air hunger. It really, really helps. And it can be dosed every hour.
Oh.
So the great thing about it is that it goes in, it does its job, and then it metabolizes out just as quickly. So that's why it can be dosed every hour. The stuff they give you intramuscularly with an injection in the hospital,
Mm-hmm.
uh, it's you can give it maybe like every 3-4 hours or something.
Mm-hmm.
But it looks like mouthwash. From what I understand, it does not taste like mouthwash.
Okay.
But it's just like this a blue liquid, and it's drawn up with a little oral syringe.
Mm-hmm.
And it's one of my favorite medications for respiratory distress.
Okay.
A lot of these, honestly, you may never need any of them, to be honest, but we like to have them here in the event that, we get ourselves in a sticky situation, and if you are having any sort of crisis symptoms, having this little kit here is very helpful. Very, very
Okay.
helpful.
So when what are some of the symptoms of when I'll say getting close to maybe passing?
End of life
Yeah,
symptoms.
what are some stuff
So-
that's like I might notice, but
You
I'm not
get-
paying attention. But I was like, okay, because I don't pay attention to stuff
I get
too
you.
much. So
So, in all honesty,
Mhm.
you won't even really be aware of it when that time comes. So you won't really be awake enough. You'll be sleeping a lot more,
Okay.
a lot more, and you won't even really be like aware of the situation. A lot of people tell me when they are, in active dying, or they are in their last week or so of life,
mhm.
that time doesn't really feel like real.
Mhm.
Reality doesn't really occur to them.
Okay.
And so you're just kind of in this sort of like euphoric kind of dreamland anyways. And the symptoms that you're going to be having are what caregivers are going to be noticing, but you won't really notice it.
Okay. Good to know. Okay.
Kind of, I think, like kind of a gift from God to just kind of make you blissfully unaware of
Okay.
what's going on. But you'll start to notice that you will be sleeping more.
Mm.
Like anytime you're not actively engaged with something, whether you're showering or, somebody's directly speaking to you, you're just going to be kind of drifting off.
Okay.
Most people in the last couple weeks of their lives will need help with everything. So showering, brushing their teeth, all like daily living activities.
Okay.
So what else? Eating and drinking will start to become pretty non-existent, because there's really no such thing as a well-hydrated and well-fed dying person. So a lot of people get kind of worried, like, oh my gosh, she's not eating. And I'm like, well, that's normal, right? You don't need food when you're dying. And so your body doesn't need it, and it knows. So your body will start to tell you, like, nope, I don't need food. And especially now, because we're in Texas, and the way we show people we love them is by feeding them, right? Getting families to understand that is sometimes a little bit difficult. They're like, no, she's got to eat. And I'm like, no, I promise she doesn't.
Nice to know.
But the lack of appetite that you are currently having is not that. It's not the same.
Right.
Okay. So I, at this point, would still encourage you to try to get more calories in, to try to eat where you can, as
Okay.
much as you can tolerate. But at true end of life, I beg families, like, please stop trying to feed her.
Okay.
Like, please stop it.
Okay. Well, sounds good.
Any other
Nice
questions?
information. Any questions, friends?
No,
Okay.
that was good information.
That was good information.
Mm-hmm.
Okay. I'm gonna put this back in the fridge.
All right. Well, thank you.
You're welcome.
Yeah. I was wondering what was in the little surprise. Look in the little surprise box.